with Dr. Shenoy. Dr. Shenoy, we've been talking and reporting about, how Kerala has seen an increase in cases, like when compared to the rest of India. Now, most of the days, 45 to 50, almost 45% to 55% cases in India is reported from Kerala. We are competing when it comes to death. We are competing with Maharashtra, and on Monday we actually overtook Maharashtra when in the number of deaths. Our average TPR, despite CM's promise, has been above 7. Between only last week it turned average 7-day TPR turned between 7 to 8%. We are now nowhere lesser than 5%, or nowhere close to India's 1.8%. So, Doctor, want to know from you, what are the implication of these numbers, and where does Kerala stand now?
See, first of all, Pritu, thanks for the question, and let me thank Agappe for this opportunity and Times of India for this opportunity. So, why this is, first of all, we should understand this is not a race between states, but this is a race to save lives of millions of human beings. This is a race to save humanity from a disaster. I don't look at this as whether Maharashtra is doing well, Kerala is doing well. Yes, there are numbers, there are implications. Definitely, Kerala was doing extremely well in containing the pandemic during the initial phase of the pandemic. We are all proud till the month of May, June, July. Kerala always did well in terms of containment or quarantining. But what happened? Because of that quarantining or containment, we had a very less spread of the virus. So virus did not spread in the community. And if you look at the recent Zero survey, which was published by ICMR, Kerala's zero prevalence is around 12%, when the country's zero prevalence is around 21 to 20%. So that indicates that we effectively contained the virus during the initial phase of pandemic in June, July, or August, till June, July. Then during the Onam, we had to open up because of the financial reasons and commercial reasons. But when we were opening up, our zero prevalence was something around 1%. So what is the meaning? 99% of the Kerala people are susceptible. But because other states did not contain it well during the initial phase of pandemic, there was already zero prevalence going on. The virus was spreading, and number of susceptibles were considerably less. So what happened to us? Virus started spreading into the susceptibles, but at that time, our containment measures were not effective, and we were not able to contain because quarantining and isolating and keeping them inside and tracing all took the back seat, because we didn't have the enough manpower. From November onward, the elections came, so the government machinery had to run the elections, so the quarantining and tracing was not possible. So what my point was, because of the effective quarantining, our virus did not spread, and in the later part, our quarantining and tracing were not up to the mark, and we couldn't do because of the logistic reasons. So currently, if you look at, Pritu has already told, 50% of the cases belongs to are accounted by Kerala. Among the active cases, if you look at the active cases, Kerala has number of active cases double that of Maharashtra. And third is the number of deaths are also around 20% of deaths of India are accounted by a state which accounts for only 3% of the India's population. So the one reason I told you, because of the susceptibles are not, we are higher numbers are there, but the death rate, if you look at the death rate, case fatality rate, we are doing reasonably well. So in terms of treating those patients who are infected, we are doing reasonably well. So is it the end of it? No, it is not, because COVID doesn't only have mortality, it has morbidity also. Post-COVID lung fibrosis. Today also I saw a patient who are post-COVID, severe arthritis, arthralgia, muscle pains, etc., etc., etc. Post-COVID also can have complications. So what is the way? The only way is we have to flatten the curve in the initial part. Now it's going up. How can we come down further? The best way, as all of us know, is vaccines. But vaccine, to deliver it to a successive people, we have around 6 to 8 months. For that 6 to 8 months, somehow we have to control this virus. How can we do that? The only way, and the most important way, is to increase testing. The Kerala, what has I told you, one reason of this rapid spread is basically the delay in peaking the curve and having more susceptibles, and that is the one reason. Second reason definitely is Kerala is more urbanized. If you go to North India, we know there are open places. If you go from one place to, from Lucknow you go to the Allahabad, from Lucknow after 20 kilometers, there is barren land. In Tamil Nadu, it's same thing. In Delhi, it's the same thing. If you leave the city, there are a lot of barren land. So, and the people don't travel from city to city that often. But Kerala is all like a city, and the population density of Kerala is very, very high. And we are all used to shop in open markets, unlike in North India, where there are a lot of mandis, there are a lot of open spaces. So these are the things which cause the curve to go up and which is not coming down. And third thing, obviously, all of us know is the elections and the opening of the theaters, and even now opening the schools are causing a spike. But what can we do realistically? And major problem with Kerala, which is one of the major issues, is over dependence on the antigen test. See, when the antigen test came, all of us thought it's extremely good. Definitely, it was a good technique because that time RT-PCR test, we were not able to ramp up the number of RT-PCR tests, and there were a lot of shortcomings. And Kerala used to do 4,000, 5,000, 6,000 RT-PCR tests. Then antigens came, and Kerala started doing 35, 40,000 of antigen tests, and suddenly the antigen test became 45,000. Initially, the company was SD, one of the kits were by SD. Biosciences, and it has a specificity of 100%, and sensitivity was something around 70%, or 70% of PCR, that is around 50%. What is the problem with that? Once we do antigen test, there is a false negativity of around 50%. So what does it mean? If you have somebody has COVID, by doing an antigen test, we are likely to miss 50% of the patients. They will go in the community, they will spread the disease. So that is the issue. But later on, there are a lot of other kits came which were even poorer quality. And Kerala had to at one point return the kits. Despite being ICMR approved, their specificity was 96%. Specificity was 96% means even if you test every 100 people, you are likely to get 4 to 5 false positives, or else your test positivity can never go below 5. Ultimately, Kerala has returned that stocks, and now I think we are going to get better traces. So the most important point is the problem. What is the problem with PCR? PCR ramping up is extremely difficult. Maximum Kerala has done around 20,000 tests. From 20,000 to make it around 75 to 80,000 is going to be almost impossible because we need machines, we need manpower training, we need setups. So it's going to be very, very difficult. And what is the problem with PCR? It takes 2 to 3 days because of these logistic reasons. If you do a test, it takes 2 or 3 days for the report to come, or sometimes it takes 1 day. And ramping up is not an easy job. What is the problem with antigen? It is very quick. So in point of care, it is extremely good, but the reports are as not reliable as PCR. So if we can have a test which can combine these two, fast and accurate, there comes the role of newer tests, be it Feluda test, be it RT-LAMP, be it all of these tests needs to come, and so that we can ramp up fast. And what is the importance of testing? If you test them early and report come early, what is the advantage? If somebody, let us see, somebody is positive, all the primary relatives, he has come into contact with 20 people. If you can get the result of those people accurately in next 5 hours, we can decide whom to quarantine. We will quarantine him and we will make him this thing, and then we will trace his primary contacts, and we can trace, and which will be very, very effective. But by doing antigen test, we are going to get 50% false negative. So we will miss 50 of them. So that is the reason we need more accurate tests, and that is the reason, and we have to go back to basics. And not only that, this is about testing, but we can never forget our old techniques of SMS, especially the masks, and avoiding the crowded places and closed spaces. I think that is one of the reasons Kerala has failed, that closed spaces are more in Kerala. We live in closed spaces where other parts of the country live in open spaces.
Right.
So,
Doctor, you said, we need to test more. We need to get into new technologies of testing and all that. So just want to know, CM has said we need to do 1 lakh tests, but we're not even able to reach, even 80,000. One day we could do 90,000, but after that we've not been able to do, last 10 days, in fact, now almost 10 days since the CM made the announcement. So what do you think is how many tests do we need to conduct per day for our TPR to get lesser than 5% and ideal 2%? How many tests would we need to do?
I think if we consistently do 1 lakh, over time it will come down to 2%. It is not possible by overnight to ramp up testing. That's what I do. What is happening? 1 lakh tests you do, you identify more positives, you isolate them, you trace their contacts and isolate. Next week, if you keep on doing 1 lakh, all the numbers will again come down to 4% or 5% or 3%. It will be a gradual decline. And over 1.5 months, definitely we will be able to do less than 5. If we do 1 lakh, test with around 70% of the more accurate ones, PCRs. Definitely, we can definitely do that. And
Right.
PCR turnaround time also has to be quick for 6 to 8 hours. There, and if we can do more lab tests, that also will add to the kitty.